Hello everyone, welcome back to our channel. If you're new here, my name is Harry Koster, and today we've got a very exciting and really important topic to dive into. We're currently running a groundbreaking study here in our clinic focusing on lumbosacral radiculopathy. We're comparing two different approaches to treating this condition with physical therapy, one combined with Newbie technology and the other one with TENS therapy. So before we get into the treatments, let's take a moment to talk about what lumbosacral radiculopathy is and how it's different from sciatica, because a lot of people confuse the two. Radiculopathy is a broad term used to describe the condition where a nerve root is being compressed or irritated, typically at the spinal level. And this will cause pain, tingling, numbness, or weakness along the path of the nerve. In the case of lumbosacral radiculopathy, the issue occurs in the lumbosacral spine, in the lower back, and it affects the nerve roots that run down the back of your legs or sometimes the front of your legs. And this can cause these symptoms into the legs and all the way into the feet. Now, while all radiculopathy is a form of sciatica, not all sciatica is truly a radiculopathy. Radiculopathy is the nerve root being compressed, causing sciatica symptoms, but sciatica itself can be caused by different conditions. It does not have to be a compressed nerve root. So both of them will present themselves with symptoms of pain, numbness, weakness, and tingling down the legs, possibly all into the feet. But we have to make sure that we differentiate between truly a nerve root compression or some other form of irritation of the sciatic nerve root. So now that we've hopefully cleared up the difference between sciatica and radiculopathy, let's go back to the true subject of our study, which is the radiculopathy. So radiculopathy will be causing pain and or numbness, tingling, weakness down the legs that can really affect your everyday mobility, that will affect your strength, may affect the way you're walking. The focus of the study is to compare two treatment methods to determine which one provides better outcomes for our patients. In combination with several other clinics throughout the country, will involve patients with lumbosacral radiculopathy. Then we're dividing them into two groups. One group will undergo traditional physical therapy combined with Newbie technology. The other group will have traditional physical therapy alongside with TENS therapy. Both groups will receive personalized physical therapy treatment designed to strengthen weak muscles, improve mobility, and improve function. But this is where the study gets interesting, because prior to starting this therapy, we will perform an EMG NCS, electromyography nerve conduction studies, so a nerve test to determine the level of nerve involvement in this condition, but then also to see the effectiveness of treatment afterwards. These tests help us measure nerve response, muscle activation, and really the overall nerve function, which are key indicators in the condition of lumbosacral radiculopathy. This will help us to really determine how much these treatments are working for our patients, to see if there is a true difference in the nerve conduction and the nerve activation and the muscle activation after 6 weeks of treatment. As for the treatment itself, both groups will receive physical therapy twice a week for a total of 6 weeks. This will give us enough time to assess the longer-term effects of the treatments as it pertains to pain relief, muscle strength, and nerve function. Let's talk a little bit more about the two treatments. First up, the Newbie, which stands for Neurobioelectrical Stimulator. The Newbie is an advanced electrical stimulation that has recently come out that's really giving us some promising results in the area of nervous system function. It targets really deeper tissues and it stimulates muscles that may not be firing properly due to nerve interference. It's designed to help reset the nervous system, essentially giving your body a chance to reboot and to function more optimally. The Newbie has shown promising results for improving long-term muscle engagement and pain relief by promoting blood flow and muscle recovery, which is particularly helpful for conditions like lumbosacral radiculopathy. It may also be helpful for other nerve conditions, as we've seen in a recent study that we got published on neuropathy with the Newbie that showed some excellent results. On the other hand, we have TENS therapy, or transcutaneous electrical nerve stimulation, a more traditional form of electrical stimulation that's been used for pain relief. The TENS works through blocking pain signals that are going up to the brain. It's a non-invasive therapy that uses electrical currents to provide immediate pain relief and promote healing. TENS works by stimulating the nerves in the area of discomfort, which helps block pain signals and encourages the release of endorphins, your body's natural painkillers. So what are we hoping to discover from this study? Well, we're comparing the immediate pain relief from a TENS unit with what we think is the more long-lasting effects of the Newbie that will truly improve nerve function. That's why we're doing the EMG and NCS studies before and after to truly see if we can make a difference in the way the nerve functions, not to just give you pain relief. We will be measuring pain reduction, improvements in muscle strength and function, and the overall recovery in the day-to-day activities, as well as improvements in nerve function. The goal of the study is to determine which method offers us the best long-term outcomes and helps our patients get back into their normal pain-free lives. So if you or someone you know is dealing with lumbosacral radiculopathy or nerve-related pain in the back and legs, stay tuned for more updates on this study. We're really excited to share our findings with you. Hopefully we'll get this published down the road, and we can hopefully provide more insights on how we can help people with lumbosacral radiculopathy the most effectively. If you have any questions about this study, if you want to learn more about it, or if you think you might be a candidate, feel free to reach out to us. Thank you for watching. Don't forget to like, share, subscribe to stay updated on the latest breakthroughs in regards to this study, but also in the field of physical therapy. Thank you for watching and take care.